Okay, so let's get started. Hi, everyone. I'm Kathy Rowe, the Executive Director of New Jersey Advocates for Aging Well, and I'm very pleased to meet so many of you for the first time. For those of you who don't know me, my background and passion are public health, and I see aging and the ability to age well as the culmination of all the aspects and the progress made in public health over the past several decades. So we rely on you and your work to allow New Jersey residents to age with dignity, with choice, and the resources they need in their community. If you need any proof of my devotion to public health, I will say that Contagion is my favorite movie and was even before COVID. So this is my background and my education and my passion. And I'm very happy to welcome Meagan Wolfe and Karon Phillips today. Meagan is the Senior Policy Development Manager, and Karon is the Policy Development Manager from the Trust for America's Health. As I said, this isn't a meeting format, and we want it to be a conversation. So feel free to ask questions by raising your virtual hand, enter them in the chat. If you'd like to hold them to the end, we will get to all of your questions. So I'm going to turn this over to Meagan and Karon now. Go ahead.
Great.
Thank you.
Thank you, Kathy. So good to be with you today. We've been having some conversations with Kathy and other folks about everything healthy aging, age friendly for a few months now. And so we're really happy, thrilled really to be able to meet with you all from, you're in the public health field, you are the practitioners, you are the ones doing this work. And so we so appreciate you, and I really appreciate the time today that we have to share with you our work. So we're going to give you a little bit of background in the age-friendly public health systems work, talk to you about the different phases of work that we've had, and then share a few opportunities that we hope you might be interested in taking advantage of. So Karan, let's go to the next slide. And so for those of you who may be unfamiliar with TFAH, Trust for America's Health, or TFAH as we're commonly known, we are an independent, nonpartisan nonprofit. We're based in Washington, D.C. We have a very robust government relations and advocacy team, and we publish a series of reports every year on the health of the nation, including our Ready or Not report, which the 2024 report comes out tomorrow. So this is very timely. The Ready or Not report lays out a number of indicators that provide a picture of how ready states are to address emergencies. And so tomorrow's report will be, I think, very timely. We also have our Pain in the Nation report, State of Obesity report comes out in the fall. And we also publish from our healthy aging work a number of briefs. You see on the screen here, the one we published last year on rural communities and what is the public health role in addressing and improving the health and social needs of older adults in rural settings. Next week or the week after, we have another brief coming out that looks at aligning the 10 essential public health services with our age-friendly public health systems framework. And we'll talk about that framework here in just a couple of minutes. You can access all of TFAH's reports and our reports on the TFAH website, which is tfah.org, and our age-friendly public health systems, or AFPHS website, is AFPHS.org. So next slide, please, Karan. So we all know that the older adult population is growing. It's growing in every state, including New Jersey. This information that I found is from the New Jersey Department of Labor and Workforce Development, and it shows the growth from 2010 to the expected growth to 2030, where the older adult population in your state is expected to grow by 62%. That's pretty representative, I think, across the country, but it's really important for us to have this framework of understanding that our population overall is getting older. There are more people over 65 than there are under 5 in this country, and that's just going to keep growing. And then the oldest of our population, those 85 and older, is also growing exponentially. Next slide, please. And all these New Jersey specific slides I did get from that one agency website. So every one of your counties is going to be seeing this projected growth. Cape May County is the slowest among the 21 counties in growth, with a 33.5% growth. The older adult population will grow in Sussex and Hunterdon, almost double, more than double. And then you can see the other data on the slide here. So this is an issue. This is a population with specific needs, specific challenges. And we saw in COVID that there are some risk factors from age and from kind of multiple complex health conditions that mean that we need to really attend to the health and social needs of older people in our communities. Next slide, please. And this one is just a map that shows and lays out where the growth is greatest. So Cape May, certainly Ocean County as well, will see the highest rate of growth of the older adult population by 2030. But you can see that every single county is going to have the growth in the older adult population. This is interesting as well, because as we see the population moving into this, shifting into these categories of older people, we have fewer younger people. And over the next 20 years, that's going to impact the caregiving workforce, the direct care workforce, because we're going to have fewer people that are in the age groups that will be caring for those of us who are now 65 and over, or will be aging into this demographic. Next slide, please. So Karon, I think I turn it over now to you.
Yep, thank you, Megan. So as Megan's already highlighted, essentially, we know that the older adult population is going to increase, especially in New Jersey, but the diversity of these populations will also be very, very diverse. And by 2024, the racial ethnic makeup of the older adult population is expected to grow about 115% compared to the non-Hispanic white population. Not only do we think about racial ethnic differences, but socioeconomic disparities that will also present themselves and putting many older adults at higher risk for adverse health conditions. So we're looking at this chart from AARP. You can see the rapid kind of uptake starting around even 2030, and we're starting to see just again the increased diversity and how our population is going to be made up. So in that, we again mentioned in a previous slide that not only will we have a diverse population, but we'll have to think about the different health conditions that many older adults will be aging with. At least 80% of older adults, and again, this is 65 and older, will have at least one chronic health condition. And then 68% will have 2 or more chronic conditions. So we're talking about, again, things that are manageable, but again, things that we need to consider and think about: hypertension, high cholesterol, arthritis, chronic kidney disease, again, all these different things, depression, not just physical health, but also mental health. And as we think about, even though it's not necessarily a quote unquote health condition, we think about the public health issue of social isolation as something else that is a need that older adults are aging with as well. But all these conditions represent 80% of Medicare's annual spending as well. So again, as we continue to think about the growing number of our 65 and older adults, we have to think about how are we supporting them as they continue to age with different conditions. So public health has contributed to longevity. We often say public health has done their job. They have helped us live longer. So public health should be at the table and can support healthy aging. Public health is very, very versed in preventative and offering quality health services. The social determinants of health are a big part of this conversation as well. We think about housing. Housing is always a big conversation, and public health should be a part of that dialogue around housing, transportation, and the built environment. Figuring out ways to support caregivers. So we have, not only do we have caregivers themselves getting older, but caregiver health is a big part of this conversation. And how do we continue to help them stay healthy so that they can provide care for their older family members? Nutrition and physical activity. There are a lot of evidence-based and public health related nutrition and physical activity related programming that support older adults. emergency preparedness is very, very key. We often encourage and empower departments of health to look at their emergency preparedness planning and think about how are older adults considered in the planning if there's an emergency. Rural health challenges, as Meagan shared earlier, we have a report, and I'll make sure I get that link in the chat for you all at some point, on specifically the challenges and the unique makeup of rural communities and what considerations need to be made. And then we also have some bright spots, some programs and opportunities that are working in rural areas to help support older adults. As I mentioned, social isolation. Again, the pandemic taught us a lot of things, and we know that social isolation, I do believe they now say it's equivalent to it's the new smoking, as they call it. So again, we know that that can exacerbate physical and mental health conditions. And elder mistreatment prevention is another key area that is critical that public health can intervene in and help to address through different partnerships. So the age-friendly public health systems, we call it a movement now. The goal of it is to explore and expand public health's role in healthy aging. Again, to help public health see how they can contribute, not to compete, but to collaborate with their partners in the aging sector, to advance partnerships. Again, figuring out ways that they can connect and enhance and support each other and make programs and opportunities and services greater. Expand the federal, local, state, tribal, and territorial engagement. So figuring out ways that the connections and the relationships can be built out at different levels. And then address the social determinants of health and to promote health equity. And to the right on your screen, you'll see our 6 C's framework, which and list out our 6 components. And we'll actually refer back to this several times throughout our presentation. But again, this framework guides and helps public health frame their work and helps see how you can, again, focus your opportunities around healthy aging. So creating and leading policy systems and environmental change, connecting and convening, again, working with different multi-sector stakeholders, coordinating existing services and support. So working with opportunities that already exist and figuring out how to enhance them to make them support and help older adults, collecting and analyzing and translating relevant data. Again, public health is very keen and very well trained and positioned to support efforts around translating data, communicating important public health information. Public health is known for their communications. And lastly, complementing existing health promoting programs. So again, that's where partnerships come in and figuring out ways to enhance different opportunities. I'll turn it back over to you, Meagan.
Would help if I unmuted myself. Can you go back to the framework slide for just a moment? I just wanted to point out to you all, when we started this work we started with a framework, but it was a 5 C's framework. We only had 5 tenets. We did not have the creating and leading policy systems and environmental changes tenet. We added that 6th C in 2021 after our pilot in Florida, because we realized how important it is to have a champion, a leader, particularly at the local level. When you are looking to make these kinds of transformative and systems changes, there needs to be someone who is really passionate and engaged on these issues. And so we wanted to make sure that we included that component in the framework that really, as Karon said, provides the foundation that we think helps really guide a state, local, tribal, or territorial health department in advancing healthy aging. Okay, now we can go to the next slide. So we started this work once we had our framework created in that was 2017 to 2018. We started phase 1 of this work, funded by the John A. Hartford Foundation, and the foundation has been the funder of all of our work. We are in phase 3 now, so they have funded phase 1, 2, and 3. We've had a few other funders along the way, but the John A. Hartford Foundation has been an amazing partner and leader in this work across the country. So phase 1, our goals were to establish a Florida model, to demonstrate how our framework could be implemented at the local level, and to build a national stakeholder network. So we did both of those things. When we started our work in Florida, we love telling the story. The Surgeon General of Florida, who is the state health officer, had never been in the same room with the Secretary of the Department of Elder Affairs. So we started this work by really focusing on collaboration and understanding from the public health perspective what's happening in every county and in all the different jurisdictions, who's doing what, like raising awareness that the aging services sector is doing some amazing and strong work and has historically, but that there are also roles for public health to come in with humility, understanding that there is a historical base of service for older adults and communities through the Aging Services Network, but with also the knowledge that not one sector can do it all, right? And so it's really important for the public health sector to begin to understand that there are roles that they can play. And one of those big roles is data. That's one of the tenets of our framework, and really important to have a database to help you understand your population, but also to help target resources and target interventions where they are most needed. So Florida also designed and built an Aging in Florida, what were then profiles, what has now evolved to become a data dashboard, and probably the most comprehensive data dashboard on older adults in the country. We love pointing to it, and we'll put the link in the chat at some point through our presentation today. And so it was really important. The work we did in Florida, we worked with 37 of Florida's 67 counties, and they all became age friendly in one way or another. And that's another aspect of this work, is that not every solution or not every strategy is going to be right for every jurisdiction. This is a very unique approach. There are other frameworks that are very prescriptive. Our 6Cs framework is not prescriptive. We intend for it to be flexible and allow health departments to really meet the needs of those people, the older people in their jurisdiction. And we also created a great network across the country with partners, national partners, as well as local partners. In Florida, we worked directly with the Florida agencies that were doing older adult work, but also with AARP Florida, with the Alzheimer's Association in Florida, with a number of different entities that really wanted to partner with public health and do that work. And so now we have those partners at the national level as well. We created federal partnerships with the HHS Office of Disease Prevention and Health Promotion. This is the entity that, oops, I think we lost the PowerPoint, Karon. There we go, thank you. They're the entity that administers Healthy People 2030, and it's really, they do a lot of healthy aging work. We also partner with CDC and the Administration for Community Living, the Administration on Aging there, doing a lot of partnership work with them. We've created a partnership around the age-friendly ecosystem, and I'm going to talk more about that later. And then in phase 2, we expanded to and did some really intensive work in the states of Mississippi and Washington. In Mississippi, they have a unified public health system, and so they don't have local health departments. We worked with them to create a statewide age-friendly public health system work plan that is now being implemented, and it's based on our 6Cs framework. In Washington, we work directly with teams of local health jurisdictions and AAAs, the area agencies on aging, where they came together as teams to do work, but also our first tribal engagement. So we've been working with the Northwest Washington Indian Health Board, which is a consortium of 6 federally recognized tribes, and working with them on how they can improve the health and the environment for health for their tribal elders. Next slide, please.
And Meagan, there's a question in the chat about why we started with Florida.
That's a great question. We get that question often. And the reason is that that's where the Johnny Hartford Foundation wanted to start. They figured, you have a large older adult population, so let's start there. And we also had a good connection with the State Department of Health. As I mentioned, the Surgeon General at the time was Dr. Celeste Phillips. She was all in and on board. She had previously worked with our then CEO, John Auerbach, and just had a really great connection. So the door was open for us in Florida. I have to say, when we began the work there, we thought we might get maybe 15, maybe 20 county health departments that would want to work with us. And we ended up with 37. And 38, because one of the people who served on our Florida advisory committee also was a health officer from one of the county health departments there. So, it was population based, but it was also based on the connections that we had there. Karon, could you go back forward a couple slides, please? So so go to the map, if you will, back to the map. There we go. Thank you. So this map shows our engagement across the country. We, as I said, started in Florida. We did some work in Michigan in partnership with the Institute for Healthcare Improvement. But we're really pleased with the amount of growth we've seen just in the last few years.
Something.
Does someone have a question? I hear some chatter. I'm just wondering if there's a question there. Okay, great.
But
Let's go to the next slide,
sometimes I
please.
feel like if I can at least.
Next slide, please. There we go. So now we're in phase 3. We started phase 3 last year. We are 1 year into it, and we're going to focus a little bit now on kind of the top 5. Well, not the ones that the components of this grant that we think might be of most interest to you. And that is our development of an AFPHS 6Cs training and implementation guide, our state snapshots, our recognition program expansion, our work with the age-friendly ecosystem, and then an elder mistreatment prevention project that we are working on as well. So go to the next slide. So this age-friendly public health system 6Cs training and implementation guide, we are developing in partnership with the Association of State and Territorial Health Officials, the National Association of County and City Health Officials, and the National Network of Public Health Institutes. This is our effort to build capacity to really help folks understand what it means to operationalize our framework, the 6Cs, and building in an equity component, partnerships, thinking about barriers and challenges, and how to move past that. So the 3 main parts of the training and implementation guide will be an introduction and what needs to happen, then laying the foundation, and that's really the capacity building component, and then leading into the development and adoption of an age-friendly public health system statewide action plan. Next slide, please. And on this next slide, I'm going to give you just a sense of what the capacity building section looks like. So we really want to provide an in-depth opportunity for those who want to take advantage of this guide to identify specific strategies that they would like to build capacity around, or that they feel like could be advanced in their jurisdiction. So folks will select a strategy, think about some questions within their jurisdiction, and then we'll have resources to explore how to answer those questions and how to really build those strategies. And if you could advance one more, and we'll show a little bit more about what this capacity building looks like. For each of the 6Cs, each of the 6Cs will have one module. So right now we're building module 1, which is based on the first C. So creating and leading policy systems and environmental changes is our first C. That's module 1. We'll have several components within module 1 for the 6Cs. But you can see we're really trying to be thoughtful in bringing together a lot of resources and thinking about what are those strategies that can really reflect and demonstrate what creating and leading change looks like. Next slide, please. And now I turn back to Karon.
Thank you, Megan. So another exciting component of our phase 3 work is they're still in development, our healthy aging state snapshots. And we're going to have, it's basically going to be kind of a profile, if you will, of all 50 states, including DC. And we're going to basically show where healthy aging indicators exist within all 50 states and DC that are aligned with our 6Cs framework. So There'll be multiple ways of looking at how is healthy aging or older adult health looked at in each state, and in what ways. Is there somewhere in the a bold grant recipient that they are looking at, again, older adults? Is the state health improvement plan call out specifically the older adults and their health? Is there a multi-sector plan for aging? Are they recognized as an age-friendly public health system state, as we showed in the previous map? So again, these are some of the examples of things that we're looking at to prepare our snapshots. And this snapshot will be available on our website. And it also enhances and builds on our ecosystem work that we've been doing. On our website, if you start to play around, you can see that we have some tools that show almost all the components of the ecosystem, the age-friendly ecosystem, where you can pull down each state and pull out information based on age-friendly public health, age-friendly health systems, the AARP age-friendly communities and cities. And we haven't quite put any universities on there yet, but we're building out, again, all these different age-friendly components. So again, the state snapshots are another part of this work that we're building on. We're approaching the part where we're going to pilot test these indicators with each of the indicators to see if they're relevant and to see if they're appropriate for the states. So the goal is to have the same indicators for all the states. It's a little tricky because different states have different information available, obviously. But it is our goal to have that and be able to, again, put that on our website as a way for states to see and assess their kind of based on their indicators as well.
Ron, I need to interrupt for just a second. Dorothy pointed out to me before we get to the recognition program that the information on one of the slides, slide 4, was actually wrong, because it says that May County will be the slowest growth of older adults. And at 33%, 33.5%, it's actually the fastest, has the fastest growing older adult population. So I just want to make sure I said that. When these slides go out to you, you'll see that data. It actually did come directly from the Department of Labor. So I should have checked it, should have double checked that, but just wanted to make sure that we got that correction on the record and recorded. Thank you, Karon. Back to you.
That's good to know. So our next component that we want to make sure that we talk about, and something that I always get a little extra giddy about, is our recognition program. And again, referring back to the map, and we might have to pull that up again at some point, but showing and highlighting where state and local health departments have engaged and adopted healthy aging as a core public health priority. So we want to honor that work. We want to highlight and, quite frankly, brag about the work. And it shows that by completing a program, it shows, and it's an opportunity to build capacity and knowledge around healthy aging. TFAH provides direct one-on-one technical assistance and promotes the recognition once it's been achieved. So if I'm done with this, if I get an email from you saying I'm interested in becoming recognized, or our department's interested in becoming recognized, or our jurisdiction should say is interested in becoming recognized, we will happily walk you through the process. We will happily review versions of your action plan. I'll explain what that is in a minute, but again, we provide direct support through the process. So we also, a big part of our recognition program is our trainings, and I will make sure to include some more links in the chat about our trainings more specifically as well. But we have a monthly training. Our training actually is coming up on next Thursday. And this year, our training is focused on equity. So we've had our monthly training in January always starts with ageism, and we focused on different state level approaches for this month. So we'll have California and Tennessee share some of the different state level efforts related to equity for this month. But I'll also talk a little bit more about trainings in a moment. But I want to get to the meat, if you will, of our recognition program. There are essentially 3 levels. And in phase 3, we expanded it to one of the levels. So I'll start with the individual recognition. This is a recognition that anybody, anywhere, anytime, literally can achieve. This involves viewing 6 of our monthly trainings. Those trainings are all recorded. We have trainings starting back from January 2020, 2021. We have years of recordings that are based on different themes. And as long as you can view them on your own time, or you can attend live trainings, any combination of that. And as long as you view 6 of them, you can become a recognized age-friendly public health system. We call them our champions. So that is anybody, anywhere, anytime, any level. Does not have to be someone in the health department, does not have to be someone affiliated with any organization. Anybody can become a champion. And I'll also come back to that, why that's also important as well. Then we also have our Department of Health recognition. This is where you complete an action plan, and I'll show you what that looks like in a little bit. But that recognition is, again, based on activities that you either are working on and have completed or activities you have planned. And again, that is something that we will happily walk through with you and help you discern where you are. A lot of times what happens, many states and many local health departments would send us their action plans and they were done, they were fine. So we're happy to walk through that with any health department or local jurisdiction as well. And then our third expanded category is the public health organization recognition. So we wanted to also provide an opportunity to highlight the work that is happening outside of formal health departments and at the local and state level. We know a lot of organizations that are not designated as departments of health are also doing amazing work related to healthy aging. So we wanted to provide an opportunity to recognize them as well. So I will talk about our monthly trainings a little bit more. We have, again, it occurs on the third Thursday of the month, and they're all related to obviously healthy aging. We typically don't, Megan and I open and close. We provide the experts and we bring in people from the field that are actually doing the work. So it's not just us talking, it is people from all over the country that we try to get. So in 2021, we focused on the ecosystem and promoting equity. We've had trainings on equitable access to the COVID-19 vaccine, social isolation, housing, public health preparedness. In 2022, we focused on the social determinants of health. So we had food security, technology, rural communities, data systems, livable communities. And last year we focused on our 6 C's framework. So each of the 6 C's were highlighted in a training. We only did one on the data. So we ended up doing 2 trainings on all the C's except for data. We did 1 training. And this year, again, we're focused on equity. And the trainings, again, focus on, they occur on every third Thursday of the month, except for in December when we typically do the second Thursday of the month. And I'll make sure I get that, those links in the chat. So the action plan that I mentioned. So this is where basically you tell us what you're doing. And again, it's based on our 6 C's framework. We have some examples that you can pull from to see what other organizations have shared. Again, typically what happens is someone submits an action plan and they're ready to be recognized pretty quickly. So here's just a sample of what the action plan looks like. So you see the creating and leading. Basically, you list whatever activities you're doing. The unique thing that we always remind people and share is that the creating and leading C or tenet can be achieved by becoming an age-friendly public health systems champion. As Megan mentioned earlier, we want to make sure that we acknowledge and note that we expanded our framework to include that creating and leading C. And the creating and leading C is based on having someone at the table, having the champion at the table. So by becoming a champion, you actually fulfill the first part of the action plan. And then other parts of it are methods of accountability and documentation. That is just if it's some kind of way that, let's say you chose another way of recognizing that you've completed the first C and it's available on the website, or you have a document that you want to attach. That's what that means. If there's any partners involved, you include that. And if there's somebody that's specifically related, that's a contact, you can include them as well. And so that's how the action plan works. It's those, the activity, if there's any documentation you want to share, partners, and if there's a separate contact for that. And then just going to go through some examples. Again, these are just examples. There are many, many other opportunities, but for the first C, again, becoming an AFPHS champion, or if you're a part of coordinating the community health improvement plan process, that would count as fulfilling the first C. The second C, connecting and convening multi-sector partners. You can serve on a coalition focused on support for older adults and health in the state. The third C, coordinating existing supports and services, working with organizations to provide a resource that highlights supports for caregivers. Again, these are just some of the examples. Our fourth C, collecting, analyzing, translating relevant data. If you decide to create, or if you already have data profiles or a state data dashboard or some kind of way that you're communicating information about large level data in your areas. The fifth C is communicating public health information. If there is a website hub, or if there's someone, okay. If there's a web page that links multiple city health aging resources together, or some kind of events calendar. And then the sixth C, complementing existing programs and health promoting programs, so you can work with other organizations around issues such as social isolation. I know during the height of the pandemic, we saw a lot of programs expand their nutrition programs or their food distribution programs to include older adults. So that is an example as well. And then I know the question is, well, what do we do with all this stuff? How do we show this work? We basically just highlight it. A lot of times we're asked, where are the examples? What's happening on the ground? What are people doing? We often refer back to you. We refer back to what we know people are doing. And so we're able to highlight and feature your work not only on our website. There's a, under the recognition program, there's a recognized leaders section. There's a listing all of our champions that want to be recognized. There's a listing of all the recognized departments of health, and we're expanding that to include recognized public health organizations as well. And we'll also feature it in our newsletter. But again, I also will just share that we will feature you in presentations that Meagan and I give when we're going to different conferences, because we want to make sure we're highlighting the work that is happening and that is timely and important. And I think, Meagan, this might be you. Was it me?
This is me. Thank you, Karon. Yeah, so we're real proud of the recognition program, just as a way to recognize, but also incentivize and give some ideas and of how you can and get involved in more healthy aging policies and programs and practice. Gives the information that we can share with you can really be hopefully a driver for some of those systems changes. So another one of the big components of our phase 3 is expanded partner engagement, and we are so excited about this aspect of our work. Right now, we're in the process of developing and co-hosting an age-friendly ecosystem workshop with the Johnny Hartford Foundation. This will be happening in April here in the Washington, D.C. area. We're bringing together representatives, and I know Emily Greenfield is on the call here today. She'll be joining us as well for part of the workshop, but to explore how we can better collaborate across all sectors that are doing work to support older adult health and well-being. Very often collaboration is tough. You may represent a health department. You may not know what your aging services counterparts are doing. Maybe they don't know what you're doing. It's sometimes really hard to carve out the time and to build trust among sectors to advance the kind of collaboration. But we also know that coordination and collaboration of work is the best way to get things done in a community. Different organizations and sectors bring different strengths to the work, different assets to the work, different connections, and can lead different aspects of the work to advance healthy aging. So we're going to bring together about 40 people representing all aspects of the ecosystem to think about and really identify some of those barriers, but also strategies for how we can better collaborate across sectors. So we're excited and hope to have a great report that we'll be able to share with the country following this event. Next slide, please. Another aspect of our work that we'll be doing is to build capacity around preventing and or addressing elder mistreatment or elder abuse. From the public health perspective, there has been a lot of work done. There are screening tools at hospitals and emergency departments. Of course, adult protective services is an area that they're very engaged in. From a public health perspective, we really believe that This is a public health issue because it affects the public's health. There are risk factors for elder mistreatment. It often goes unreported, unnoticed. There are a lot of implications, health implications for people who have been victimized by caregivers or others, whether it's a financial, physical, emotional, mental abuse. There are all different kinds. So we are working to better understand the issues and to develop some guidance for public health. We will be presenting them according to our 6Cs framework, of course, because that's how we like to organize, helps us to stay focused. So we're going to be hopefully providing ways to think about systemic factors and societal problems and thinking about system solutions, bringing different community actors together to identify what are some of the best interventions, kind of reframing the issue as a public and not an individual issue, thinking about what data might be needed on those risk factors, including both the health and environmental data, assessing the environment for funding and resources and other program supports, and then working in partnership with healthcare systems to identify and prevent elder mistreatment. We're doing this through a survey. We'll be having a survey go out next week through our newsletter listserv. We'll be doing an environmental scan and literature review on elder mistreatment. We will be conducting key informant interviews and then pulling all this information together to develop guidance. So stay tuned for that. Later in the year, we're, as I said, just getting started with some of this work. Our survey, as I said, will go out next week, and we're excited to be able to provide this tool for the public health sector. Next slide, please. So I think, yep, we are at the end of our formal presentation. You can see on this screen our AFPHS website, the TFAH website, and then if you want to get in touch with us, I think Kathy's going to provide our individual email addresses, but you can always reach us at afphs@tfah.org as well. So Karon, let's take the slides down at this point, and Kathy, we can turn it back to you to moderate any questions or discussion.
Okay, terrific. And we will send the recording and the links that were put in the chat and other documents out to everybody who registered. So you'll be getting that in the next few days. So we can do it by just raising the hands, I think. Does anybody have questions to start? Go ahead, Dorothy.
Yeah. In the slides, it looked like there was one slide that went by really quickly that caught my eye, and it seemed like it was illnesses or diseases that befall older adults 65 and plus, and I thought that was kind of interesting.
Right. So I think that's the one, the 10 common chronic conditions slide. Yes, that came from AARP, and we feel like it's important to recognize the different types of chronic conditions that older adults face, because many of the public health interventions that you all work on are preventative, right, and can help prevent some of those chronic conditions or address them. And it's important because older adults that have multiple chronic conditions they can be very complex, right? Their care can be complex, but it's really important to address those early. And that's where that life course perspective kind of comes into play. But yeah, thank you, Dorothy, for bringing that up.
Could we see it just one more time? Sorry.
Oh, sure. Ron, you want to bring that back up? It's slide number 7.
And while she brings that up, Donna was next for questions. Donna Lisi?
Yes, hi, thank you. I have a question. I'm actually chair of my township's Board of Health Advisory Council, and I also serve on my Office on Aging Advisory Council, and I'm also chair of my county's local advisory council on alcohol and drug abuse. And in all those capacities, one thing that has become clear is the needs of older adults when it comes to mental health services. We're seeing a growth in this country of a shift in the dynamics of the age of the opiate epidemic, and we're seeing more and more older adults being part of being caught up in the opiate epidemic. So I'm just wondering, what is your organization, or are you aware of what other organizations or townships, municipalities, I'm in New Jersey, are doing to address this concern in older adults? when we did a local needs assessment, my township actually did a local needs assessment. And one of the things too that came out is that mental health services need to be prioritized, especially in older adults who are feeling the sting of the isolation, as you mentioned, from the pandemic. So I'm just afraid that, that addition to anesthetizing that feeling of isolation, as well as, unaddressed pain, are all driving forces for this problem in our society at this point. Thank you.
Yeah, thank you, Donna. It's a really important issue. We do know that there are a couple of county health departments that we've worked with. One of them in Florida that is working really hard to address mental health issues, and particularly because of the hurricanes that hit in Florida. That's an issue that they see there, that that folks, especially when they're displaced because of a hurricane, that there can be a lot of mental health issues. So the approach that they have taken down in Charlotte is a collaborative. It's a collective impact type approach where they make sure that older adults are seen, that they're identified, and I think that goes to the data issue and the identification issue of making sure that we know who the older adults are in communities that need these types of interventions and need this type of help. When it comes to social isolation, I think that again is another way that public health can lead, by working with aging services to identify who the older people are who are socially isolated, but then connecting those older people with services in the community that they may not know exist, that their caregivers may not know exist. And so public health, what we're seeing is that public health plays that connecting and convening role, and that coordinating of services role. That's where we're seeing public health being the most effective.
Thank you. Yeah, that was one of the problems that were identified, was the connecting of services. But sometimes you have a lot of older adults that are supported by family that may not necessarily be part and get messages from county services and things like that. And so trying to identify who those people are and trying to get to them, getting the word out to them and services available has been a challenge. And I'm in a suburban area, and I can't imagine how that's done in a rural area. So maybe someone can speak to that. Thank you.
And Donna, I'm so glad you brought that up, because, in the past year, 18 months, New Jersey has really made a commitment to not only the opioid epidemic, but in mental health, expanding mental health services overall. And in each sector that they're addressing, they have not focused on older adults. And that's something that I think we all need to ask for. Things don't get better when you turn 65. So we need to push for more acknowledgement of that and more support and programs. And I don't want to take away from any of the other programs. So we are addressing, maternal and postpartum health. We're talking about mental health and high school students and college students. We are not having those same conversations about older adults in New Jersey. And that's something we really need to move the needle on. So thank you for bringing that up.
Let's talk offline, since we're in the same state, and we can work together on that. I don't want to take up more time on this, but one of the things is I'm also involved with my township's municipal alliance. And I'm not sure if every state has them. I know New Jersey has them. But I know this current grant cycle ends next year, and the focus has been on youth. So one of the things that we're hoping to do, at least in my county, is with the next grant cycle, expand that scope, because there wasn't no age restrictions in terms of how the monies for the municipal alliances can be channeled. It's just that was what the plans were when they were initially submitted, was for youth, because that was the main focus. But so in the next grant cycle, we're trying to expand that to include older adults, but that won't be for for another year or so.
Yeah, that's excellent. I also did want to mention that I think a lot of times the barrier is that older adults themselves, there's some stigma associated with mental health, and they may not realize that they're lonely. They may not realize that they are socially isolated, or they don't want to admit it. And so I think that there can be communication campaigns that can go out to help older adults better understand themselves, or help their caregivers and family members understand what it means and the health implications of social isolation and mental health challenges that they need to be addressed. And I think that it's a tricky issue sometimes, but I think public health does have a role to play.
Right. Next we have Emily Greenfield, and then after Emily, Gladys Harris.
Hi, everybody.
Hey,
I'm outside right now. Excuse the background and the noise, doing my healthy aging as I'm listening to all of this great work. I just wanted to say thank you to the national partners and presenters for sharing this with our state, and thanks to Kathy and NJR for organizing it, and thanks to everybody who's here. I just wanted to comment. I mean, I see Melissa Talker is here from the Division on Aging Services, which is under the Department of Human Services, which is fantastic. I don't know if there's other people from other state departments who are on our participant list, but on the assumption that we don't have anybody from the NJ Department of Health who's joining us today, I think it just speaks to how it's working in New Jersey with age-friendly social change, that, you know, we've been collaborating on age-friendly communities with catalyst support from private philanthropy. More municipal governments are coming on. Slowly, more counties are coming on. The state is slowly moving in its path toward its own age-friendly framework in response to the age-friendly community. So I just wanted to share the reflections on this context of kind of like who's at the table here learning about this, to demonstrate that I think in our state, the way it oftentimes works is that we build the bottom up change. Like, it's really, you know, and I appreciate the slide showing that any individual can become an age-friendly public health champion. You don't have to wait for the state to say that this is something, you know, formally state that this is something important, or wait for your local public health department to sign on to something. That every one of us here can actually contribute to a metric to show people at the upper systems levels that the people who are working on the ground and in communities and with local offices actually really care about this and are already, you know, doing something by making time to come to this learning, by making time to go to these wonderful national webinars. And those are data points. You know, the more kind of metrics we can develop of this kind of grassroots groundswell for a push for our state leaders to be taking this more seriously and being more proactive in their own progress in the halls of Trenton, I think it's just the way it kind of works in New Jersey right now. And so I just wanted to reinforce the importance of, you know, taking a next step or committing after this webinar to doing something that can help not only your own journey in this space and your own local networks, but really can contribute to a statewide movement that I'm very hopeful in all of our lifetimes we'll see some real progress. That's all.
Thanks, Emily. Gladys, can you unmute yourself?
Hi, thank you, Kathy. So I have two questions. Number one, I think this is a great initiative. My concerns are, what's the plan to address solo agers? I'm in private practice and I get to see a lot of solo agers and the issues that they get to grapple with. So I think that that's a subset of the aging population that we need to pay attention to. The second concern that I have is, what's the plan to incorporate law enforcement? And I'm not talking about adult protective services. I'm talking about law enforcement, the officers that are trolling around on the streets every day, into this initiative, because they need to get a much better understanding from their very initial training on how to deal with the elderly. Some of the things that I see, and I'm fortunate in that I live in the northern New Jersey and in a community that is rather wealthy, but some of the things that I have witnessed are appalling. And I really do believe that we need to find a way to train law enforcement when they're first going to the police academy. Start the training there, because they're not getting it. And the last thing I want to say is, Kathy, there was an initiative here in New Jersey that was done, I want to say in 2021, that had a lot of the same topics and issues that this study is looking at. And I will put you in touch with the person who did that. The counties involved were primarily northern New Jersey counties, but I don't believe that we should reinvent the wheel. And a lot of public health people from those counties were involved. So anyway, I will offline send you that information.
Okay.
Thank you.
Thank you, Gladys. Yeah, I'm with regard to law enforcement, I mean, I think this speaks to how important it is to be thoughtful when you're putting together those coalitions to address older adult health issues, whether it's social isolation, emergency preparedness, mental health issues and awareness, elder mistreatment prevention, whatever issue it is. I mean, all of the entities, agencies, or services that touch older adults in some way should be brought in. They should all be at the table. And that's sometimes tough because we don't always think about, I mean, Gladys, you're obviously being very thoughtful about, who are those people that may be the first responders to deal with older adults who are having, you know, if you have an older adult in community with dementia, you know, and maybe they leave their facility or they walk out of their home, and emergency services or law enforcement are the first ones to, you know, to come into play there. It's really important to make sure that they're all on board. I mean, we're having the same discussions about preparing the public health workforce from the beginning, and public health programs. Public health education needs to include information and data about older adults and these strategies as well. So we still have a lot of work to do. In a lot of ways, Gladys, we're just still at the very beginning of this work.
If I can add just a little bit, Gladys, you're absolutely right. One of the things we have noticed, and again, this is not the complete resolution to your question, but we have seen models where during the pandemic, the police were involved in helping coordinate and get access to older adults in these communities to get vaccine distribution. We've seen in Washington State specifically, I'm trying to remember she's with the aging department of health. I'm getting her title wrong, but they are coordinating and helping to provide training to first responders and police officers, especially during mental health crises. And instead of arresting people that are having a clear mental health challenge, they are working to provide training for first responders and police so that they understand and can better respond. And it does involve contacting the appropriate parties, but they're at least working with them to try to get them to better understand who they need to work with in those instances, and not just assume this person is having a bad behavior moment and being arrested. So again, it's not the answer to your question, but it is happening. And to Megan's point, it does mean who needs to be at the table in the beginning.
And I've seen a wide variety. Like this is in New Jersey, we've got 500 some different towns doing things 500 different ways. And I think some towns or municipalities that have focused on community policing have done more in this area. Some haven't gotten there yet. But I also want to say that the fire departments are very important in this, and along the same line. If a policeman shows up at your door, people assume something's wrong. If the fireman shows up at your door, people open up the door and pour him a cup of coffee. Our fire departments have the trust of the community. They have very positive relationships and positive feedback, where people react very differently than they would to a police department. And so many of the EMS services are housed in the fire departments. So I think that just add them on to that conversation and that work. Okay, any other questions for our guests? Go ahead, Donna, you have another one?
No, I just put in the chat on like I said, I mentioned I'm chair of my township's Board of Health Advisory Council. I'm in Franklin Township in Somerset. We have piloted a program called Arrive Together, in which a police officer, a social worker goes out with a police officer on a mental health call. And from the feedback I've gotten, it's been extremely well received and overwhelmingly positive. And with a pilot for the county, and it's going to be copied in other municipalities in our county. So anyone who's on the call, if you're interested, we're going to be having the team, the officer and the social worker attend our next Board of Health Advisory Council meeting, which is going to be April 3rd at 7:30. I welcome anyone who wants to learn more about this program to join us. It's open to the public, and everyone is welcome. Thanks.
Thank you. And I just put in the chat the link for information on our upcoming conference on May 17th. Shannon Lyons will be one of our presenters and talking about age-friendly public health and the work that she's doing up in Garfield and Bergen County. So I hope you will be able to join us for that. Well, if there aren't other questions, we'll let you all go. I really appreciate you joining us, and I will send out the recording and any attachments and slides that were dropped in the chat. We will be in touch. We're very, very glad to see you, and look forward to talking to you more about this really important subject. Thank you so much.
Thank you, Kathy. Appreciate the opportunity.